My name is Dr. Ashish Ranjan. I am chest specialist at National Institute of TB and Respiratory Diseases, New Delhi. So I am catering for TB patients as well as other respiratory illness patients. Chest X-ray play an important role in detecting TB, as we know that TB can affect any organ of the body except hairs and nails. But the most common form of TB is the TB of lungs, which is also known as the pulmonary TB. The pulmonary TB can be detected by the chest X-ray by specific lesions which we can pick up in the chest X-ray. This can be technically called as a consolidations, cavity, nodules. But these lesions are not as specific or exclusive to TB. It can also occur in other respiratory illness. So the pulmonary TB which we detect in chest X-ray should be correlated in clinical context as well, and it should be confirmed by the sputum examination by smear test or molecular diagnostics like CBNAT test and culture test. So molecular diagnostics are now backbone of TB diagnosis. So currently 4 types of molecular diagnostics are available. The first is the CBNAT test, which is popularly known as the GeneXpert test. It can detect TB bacilli in 2 hours. It can also detect the resistance to one of the most important drug, rifampicin, and it has very high sensitivity, so it is very useful test. Another test is the TrueNAT test, which is the indigenous version of GeneXpert or CBNAT test, but it has a little different mechanism of operation. But the benefit is that it is a point of care test and it can be installed even in a peripheral setting. So it is a choice of PCR test or choice of molecular diagnostics in peripheral areas. Third test is the LPA test, line probe assay, which can detect TB bacilli as well as the resistance to 2 drugs, isoniazid and rifampicin, but it requires costly infrastructure. And the fourth test is the gene sequencing, which is upcoming and still in India it is available in limited places, but it requires costly equipments. So quantiferon TB Gold test is a blood test which can detect TB infection, also called latent TB. It detects interferon gamma released in blood after exposure to TB bacteria. However, it cannot distinguish between latent TB and active TB. It is a laboratory-based test and requires costly equipment. MAN2 test is a skin test performed in vivo to detect latent TB. This also cannot distinguish between latent TB and active TB, similar to quantiferon test. In MAN2 test, we give intradermal injection of purified protein derivative and measure the resulting induration. It can come false positive after BCG vaccination. So if you have cough of 2 weeks duration, fever, weight loss, please visit the nearest health center for sputum examination and consult the doctor. If you are diagnosed with TB, please take your treatment timely in adequate doses and follow your doctor's advice. Don't interrupt or stop treatment without advice of the physician. Take high protein balanced diet, do some outdoor activities in consultation with your doctor, and take good sleep.